This video is going to go over the second part of imaging anatomy of the pelvis. So we spoke mostly last time about conventional radiography in terms of the pelvis, and so today a lot of it's going to focus on two modalities, primarily being CT as well as ultrasonography. So we'll start out by looking at a transitional zone between the abdomen and the pelvis. So this is going to be found in the false pelvis. You want to remember that when we talk about pelvic imaging, you would certainly include this region in that designation. And so in this image, you can see the sigmoid colon as it's coming through and eventually becoming the rectum. And you'll notice that it has a number of diverticula in this example. And so you see some hyperintensity around those diverticula, which indicates that there's an inflammatory process likely going on there. So this person likely has a mild case of diverticulitis. And then I want you to think about what bony structure you think that these two bones are representing here, which we'll come back and answer that here in a little bit. But you can see the coccyx back here posteriorly. Moving more anteriorly, you can appreciate the bladder, and then the abdominal wall is up here. A hint for the bony landmark is this muscle right here represents the iliopsoas, and then posteriorly back here you're looking at the gluteal muscles. So we're going to start out by talking about structures in the male pelvis, and then we'll transition in and go through various structures in the female pelvis. This shows a cross-sectional view of the male pelvis and points out a couple of important structures. We're going to go through these structures in a clockwise direction, starting in the upper right-hand corner of the left image. Right here, we can appreciate the spermatic cord, which is located adjacent to the common femoral artery and vein. You want to note that the femoral vein is larger than the femoral artery. It also tends to be darker, so the artery has more of a hyperintense appearance to it relative to the vein. You can also see the inguinal ligament cutting across the anterior surface of or it looks like at least it's anterior to or superior in some ways to the spermatic cord and the common femoral artery and vein. Moving down this way, you can also appreciate the obturator vessels, so obturator artery and vein. Once again, the vein is going to be slightly larger than the artery, though it is a little bit more difficult to appreciate that in the obturator vessels versus the femoral vessels. You'll also notice the location relative to the bone right here, which is the ilium. And then along the inner surface of it, you can see the internal obturator muscle, or the obturator internus, which is of course going to be moving into the gluteal region, ultimately to attach to or insert on the femur. Through here, you can appreciate some of the pelvic venous plexus, which is located through this region. And we've talked a little bit about some of the pathology related to the pelvic venous plexus previously. You can see the bladder in the midline anteriorly, and then you won't really see the orifice generally, but you can usually see a cross-sectional view of the ureters right at the UVJ, the uterovesical junction. Back here you can see the rectum, which is usually going to be filled with a combination of air and stool. And then just posterior to the bladder, you'll also be able to appreciate at this level the seminal vesicle. Remember, below the seminal vesicle is going to be where we'll see the prostate. So at this level, you see the seminal vesicle, and then once you get below the seminal vesicles, at that point, you'll be able to appreciate the prostate. Moving over here to the right image now. Once again, we'll start out up in the upper right-hand corner, and we'll just move our way clockwise around the image. So once again, we can see the common femoral artery and vein. And then next, just medial to that is where we'll see the spermatic cord. Moving down from there, once again, we can see the obturator artery and vein. We can now see the ischium, with and so this is going to be the acetabulum in here, with the head of the femur sitting in the acetabulum. You can see the sciatic nerve, which just depends on the individual as to how well you'll be able to see the sciatic nerve, but generally you'll be able to see a good cross-sectional view of it at this level. You can see the obturator internus a little bit better at this point, again as it's looping around and exiting the pelvis to attach to the femur. You can see the internal pudendal vessels, which are usually sitting right up against the obturator internus. They're sitting in the pudendal canal. So a lot of the images, when you see those, they'll be sort of right up here against the obturator internus. You can now make out or you can once again make out the rectum, which is still going to be filled with a combination of air and stool. The levator ani muscle can be appreciated. You can kind of see the sling, the puborectalis wrapping around the rectum at this point. You can see part of the coccyx posteriorly, and then just anterior to the rectum, you can see the prostate here. So once you can't see the bladder anymore, usually at that point, that's where you'll see the prostate, because that's sitting just below the bladder, at the base of the bladder. Whereas again, if you can see the bladder, you're likely going to be able to see part of or you might be able to see the seminal vesicle, depending on how full or high up in the bladder wall that you are. And then the urethra, usually you can make out just a very small opening in the midpoint of the prostate, which represents the urethra, of course. And then anteriorly here, you can appreciate the pubis and then the pubic symphysis. So let's go through those now on a cross-sectional or axial view, CT view. So we have the bladder, which is this whole large, centrally and anteriorly located structure. Then we can see the external iliac vein and the external iliac artery. So this is before they are going to become the common femoral, or the femoral artery and vein. So once again, notice the size of the vein relative to the artery, and notice the color. So see how the artery is somewhat more hyperintense relative to the vein. You can see the iliopsoas muscle on the surface of the ilium. And then the piriformis muscle, now you can appreciate that here posteriorly. So as we move more inferiorly, that's where you'll be able to start seeing the obturator internus. But at this level, we're seeing the piriformis. And then we also still see the sacrum at this level. So we're quite a bit higher up than what either one of the previous images showed. Now we're moving down a little bit further. So here you can see the external iliac artery and vein once again. The bladder is appreciated well again. This is the acetabulum with the head of the femur. So the femoral head there sitting within the acetabulum. The internal iliac vessels can be appreciated here. And then the seminal vesicles you can also see right through here, just posterior to the bladder. And then you can get a really good view of the rectum here. So all of this is rectum. So the black represents gas, whereas the rest of what you see within the lumen of the rectum is stool. As we continue descending here, actually, this is a higher view. So in this case, we're up in the false pelvis, so you can see the ilium and the sacrum with the SI joint right here. This is the sigmoid colon, and you can see this is where it's transitioned now to form the rectum. Anteriorly on the patient's right, so your left side, you can see the terminal ilium with a little bit of contrast agent in it, and so that's why that is appearing so bright, so hyper intense, is due to the presence of the contrast material within the ilium. Now we have the external iliac vein and artery again with the bladder here in the midline. Once again, you can see the rectum just posterior to that, as well as part of the sigmoid colon next to the bladder as well. Up here we can see the inferior epigastric vessels, and we're going to follow those as we descend, and eventually you'll be able to see the connection with the external iliac vessels as well. And then we have the ilium right here with the iliopsoas muscle on its anteromedial surface. So as we continue going down, watch this area here. So again, we're going to start here. So keep an eye on the inferior epigastrics as we descend, and you're going to see them ultimately attach or anastomose here with the external iliacs. So here you have that connection between the external iliacs and the inferior epigastric vessels where they're coming off. And then I'm going to go back up a couple slides here. So now I want you to pay attention to the bladder and the rectum as we descend. So you'll see how they change. Again, you can see how as we're descending, you can see where the rectum, there's a fair amount of stool more proximally, and then as we move more and more distal, you'll see progressively more and more air filling that space. And then now at this level, so I'm just going to go back up to this region right here, where again you can see the inferior epigastrics attaching to the external iliacs. And then at this point now we can see the femoral vessels, so the femoral artery and vein, and then the inguinal ligament cutting across right here. And then these are the seminal vesicles back here posterior to the bladder, where you're starting to be able to appreciate those. And then the pubis is now starting to show up as well, so you can see how that's going to be moving progressively in a medial direction as you approach the pubic symphysis. And then back here you can see the ischium. And in this image we can once again appreciate the femoral vein and the femoral arteries, or femoral artery and vein. You can see those on both sides here. You can also appreciate the prostate. So we're getting to the lower extent of the bladder, and so you get a good relationship between the rectum and the prostate, so you can get a good sense of why it's so effective to do a digital rectal exam in order to palpate the prostate for presence of either benign prostatic hyperplasia and or tumor, carcinogenic tumors, neoplasms. And then right here, you'll notice that there's an artery and vein running together on both sides. This is going to be traveling through the obturator foramen. So these are the obturator artery and vein, which again, they should both be similar to other vascular units that we've looked at, where the vein should appear somewhat darker and larger than the artery, but in this person it's a little bit hard to appreciate that relationship. And then looking here posteriorly, as we descend a little bit further, we can see the ischioanal fossa showing up on either side. So again, that's going to be filled with fat, and then you're going to have the rectum here just anterior to it, as well as the prostate anterior to that. And then within the ischioanal fossa, or kind of along the lateral wall within the pudendal canal, you can see the internal pudendal vessels that are located right here, traveling within that pudendal canal. Oh, sorry, and then up here, this is the spermatic cord is being pointed out in this individual. So eventually we'll start being able to see the structures of the penis showing up. So here we're at the distal most extent of the anus. And so here you're able to see the penis is starting to show up right here anteriorly. So we'll just follow that down as it descends. You can actually make out the corpora cavernosa on either side, and then this corpus spongiosum is going to be located right here on the ventral surface of the penis. And then we can also see the femurs on either side here and here. Then as we continue descending, once again we can see the ischium, and eventually we would hit the scrotum, though we're just now approaching that location in this individual. So this is the distal part of the getting towards the distal tip of the penis around the glands. This is an example that we've actually seen and talked about before, but this is a patient that has prostate cancer, and so they've had these metal radioactive seeds implanted within the prostate in order to help treat the tumor with radiation. And so again, this is what it looks like on a cross-sectional view. So in the last lecture we looked at it on conventional radiography, but this is actually what it looks like in cross-section. And then now we're going to look a little bit at ultrasound. So the upper image on the on the upper right image here is showing a traditional homogeneous view or view of the testicle, in which the substance of the testicle should appear relatively homogeneous. Whereas the image below, you can see there's a fair amount of inhomogeneity located within the testicle, and so that's indicative of a seminoma. And another abnormality here in this bottom image is a hydrocele. So this is where you can make out the testicle, which looks relatively healthy. Again, it looks homogeneous throughout its entire extent, but you can see where there's fluid located around the testicle within the scrotum, and so that's indicative of a hydrocele. This is another ultrasound view of the testicle, and what you'll notice is, again, the substance of the testicles look quite good. They're homogeneous, but you'll notice that this is with a Doppler activated, and so you can see some of the vasculature of the testicle showing up on the right side, but on the left it's totally absent. So you can see a little bit of activity up here, but once you get down into the testicle itself, it's completely absent. And so this is an example of testicular torsion where the blood supply has been cut off to the testicle, and therefore that's why it appears this way on the Doppler ultrasounds. Again, that's an example of testicular torsion.